All right, let's get started. Welcome everyone to today's webinar. We're going to be discussing how Sanford Health is transforming the nurse workforce through data and technology. My name is Iman Abuzaid. I'm an MD by background. I've been in technology for the last 10 years of my career, and I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for permanent healthcare workers. Incredible Health is the only platform where hospitals can hire permanent and experienced nurses in 20 days or less. We flip the script where employers are applying to the talent instead of the other way around. Joining us today is Erica DeBoer. She's a Chief Nursing Officer at Sanford Health. Sanford Health is the largest rural health system in the US, headquartered in Sioux Falls, South Dakota. It operates 47 medical centers and 224 clinic locations and employs over 9,000 nurses, and provides 5.2 million outpatient and clinic visits each year. Erica supports the clinical teams with evidence-based practice and research, leads the enterprise care management group, and oversees the integration of clinical initiatives. Before she became the CNO in 2021, Erica also served as adjunct faculty for the nursing programs at South Dakota State University and the University of Sioux Falls. We're thrilled to have you here, Erica. Thank you so much for joining.
Thanks so much for having me.
All right, so just a reminder to everyone in the audience, this is designed to be an interactive session. Please feel free to submit questions in the chat and we will answer them as we progress. And we'll also have time set aside for questions at the end. This webinar is being recorded, and so a member of the Incredible Health team will be in touch to share the recording afterwards as well. So today we're going to be covering, here's our agenda. We're going to be covering these topics, including transforming the nurse workforce with data and technology and what Sanford Health and Erica's team did in particular. We're going to be talking through nurse retention strategies, nurse hiring strategies, how Incredible Health can help, and as well as Q&A. All right, let's start with a very brief market overview. So we're, set the stage so we all understand where we're at with the state of the US nurse labor market. So we are all operating in the US. Our demand for healthcare as a country continues to increase because the US population is aging, but we as a country have not done a great job of increasing the number of healthcare workers to meet that demand. 1 in 8 Americans works in healthcare. It is the biggest labor sector in the country by a number of workers as of since 2018, but we are dealing with a very, very severe shortage. The nursing labor shortage is the #1 labor shortage in the United States, according to the US Bureau of Labor Statistics. We are on track to be 1.1 million nurses short by the end of this year. The acute care nurse turnover nationally, the national average right now is about 18.7%. It increased during the pandemic and in 2022 as well. It is starting to come down a little bit, but it's still a lot higher than what many nursing leaders and other leaders would prefer. The labor costs continue to increase. Right now for publicly traded hospitals, labor is at 48% of revenue. And those labor costs are increasing not just because of temporary labor costs, wages, but also the permanent nursing labor, their wages are increasing too because of the shortage. And then finally, the days to fill right now on average, the time to fill a permanent and experienced nurse role in a hospital setting is 89 days. All right, these metrics resonate with you as well, Erica?
Absolutely. It's what all of us are living every day, that there's not enough. It takes too long to get them onboarded and find them. And then I think, as you mentioned, the aging population certainly creates that complexity gap with our new staff, as well as just the complexity of care that they're desiring and needing, especially in our rural communities.
Absolutely. The next topic we want to just touch on very briefly is double click a little bit about what's going on with nurses, right? And when we have 1 in 4 nurses in the US on the Incredible Health platform using it to manage their careers. And so when they are creating profiles on Incredible Health, we're asking, why is it that you're considering leaving your job? And these are the reasons ranked in order of how often they're selected. So first and foremost is looking to advance their careers. That could mean looking to specialize further, looking to cross-train, looking to move into management. It can mean a range of things. There's something to do with career advancement, because many nurses are dedicated to continuing to progress their career. The second most common reason for why they're considering leaving their current job is they're looking for a more flexible schedule. Some of our recent data reports show that 80% of younger nurses are looking for a more flexible schedule, but only 11% of the hospitals are actually offering flexible schedules. So there is definitely a disconnect there. Third is something to do with geography, right? They're looking to relocate, or they're trying to reduce their commute time. And then the fourth is higher pay. We work with many hospitals and health systems, over 700 of them across the country. We work with many CNOs and CHROs. There's a lot of focus and concentration on item number 4, but we are increasingly seeing more and more hospital leaders focus on number 1 and 2, because it is a key way to hire nurses and retain nurses. And then this is just a recent survey that we did with hundreds of thousands of nurses recently. This is from March of 2023. And you can see some of their top concerns here. There's concern with staff shortages, a concern with burnout, concern with salary and benefits, their work environment, scheduling, and limited career advancement. All right, I was mentioning to Erica earlier that this is actually, yes, the situation is dismal, but this is also an opportunity for all of us as leaders. I know there's many leaders who joined this call as well, from nursing, from HR, from operations, from hospitals across the country. But this is an opportunity to really focus on many of these problems and to drive results too, because we do have the attention of hospital CEOs and COOs on the problem as well. All right, I will turn to Erica. She wants to share a bit more about Sanford Health and how you're thinking about some of the challenges you're facing.
What a great set of data to help us really understand where we're spending our time and our effort. I would agree with you that there's some things that we can control, and there's others that really need to be individualized to those individuals that serve in our communities. When I think about Sanford Health, just by way of background, some of the key challenges when you think about being the largest rural integrated health system, and really our goal of being the premier rural healthcare organization in the United States, we have to address access, quality, as well as sustainability. Several of the feedback from the nurses, as you well noted, is flexibility is incredibly important, as well as the challenges, even with just how long they have to commute. So when you think about access and you think about rural health in general, the geographic distance that our patients have to travel force us to actually look at our workforce differently as well. How do we offer up some of that flexibility to help make sure that we can give care close to home? As you mentioned, we've got 47 medical centers, which means several of those are critical access hospitals. They're in the communities where our patients want to receive their care. Additionally, as you pointed out, nurses shortage is certainly a challenge, but not only in our clinical teams, but also in our provider shortages. It's tough for those physicians and APPs to want to be in our rural communities until they have a chance to experience how amazing it is. Additionally, when we think about access, I think about it from the lens of technology and our broadband. I know it seems a little bit strange that we'd even consider that, but that has been one of the challenges that we've been navigating over the last several years. From a quality perspective, I think the rural challenges in some cases are similar as it relates to social determinants of health, but there's also an over-reliance in some cases on those primary care physicians. That population have a tendency to be a bit older in our rural communities, as well as a higher incidence of chronic disease. And so an opportunity for all of us to really hone in on how do we manage that chronic disease with the challenges of social determinants of health, specifically related to literacy, as well as really the lack of healthy food and housing as one of those big challenges. And as mentioned, the geographic distance that they have to travel is quite extensive. So when you think about transportation, that's one of our major points of challenge for our patients to access care. When it comes to sustainability, obviously a lot of what we're talking about is when you don't have the workforce, it makes it challenging for us to care for the patients close to home. But more importantly, when you look at sustainability and some of the long-term care facility closures, there's certainly some opportunities to continue to look at different ways that we not only support our workforce, but also explore ways to get creative around how we use technology to meet the needs of our patients, and then have our amazing nurses on the other side of that helping to deliver care to our rural communities in a different way.
Okay.
A couple other things, again, just a couple talking points. I thought the slides would help us just anchor a bit. I think all of us are well aware of the workforce challenges that all of us are navigating on a daily basis. I think as I start at the very left-hand side of the graph, ineffective and reactive staffing and scheduling. If there's one thing that healthcare is really good at, it's tradition. And scheduling is one of those things that's very traditional as it relates to, in some cases, we have a technology that we use, a mobile app, but guess what? We still have that beautiful Excel document that we manage on a day-to-day basis. By having that Excel document and that lack of integration in some cases, it creates that situation where we can't effectively manage what the workforce needs really are, as well as that black and white of we have to cover our shift, instead of really addressing our workforce needs specifically related to flexibility. Certainly, as highlighted with some of the statistics earlier, that competitive labor market is absolutely true. Not only can nurses leave our inpatient hospital settings to go for other work, in some cases, the stress of that environment, the workplace violence that they're managing certainly propels them into other potential professions because of the competitive labor market. I think as highlighted with some of the statistics that Incredible Health already did, when you look at persistent understaffing and some of the moral fatigue that our teams are dealing with, not only from COVID, but also just some of the nature of society, as well as other things that put pressure on our teams, that persistent understaffing certainly leads to more of that fatigue that we have to pay attention to as well. Obviously, those high workloads and that complexity gap that I referred to leads to some of that additional potential for burnout as well. I think when we explore much to what Incredible Health is helping us to try to address is how do we get to our permanent staff? That team dynamic, that environment in which our people are working on is so important to the health, not only of them as our healthcare workers, but their effectiveness to give that quality care. So by relying on agency staff, it creates a different environment on your units, which also then increases the cost, which means we have to shift those costs and really our ability to support staff to a different space to make sure that we have the staff that we need.
So you're using some predictive analytics and data analytics to drive some of these solutions. Would love to hear more about that.
Absolutely. As I highlighted, data and analytics have really been a key. They were really something that was incredibly important to all of us as we navigated the COVID pandemic. It was really the unknown. And so we use some of the philosophy, we use some of the insights that we learned from COVID to try to really help us understand what are those staffing needs going to be. So what in the past, obviously, as I've highlighted, it was very reactive and very outdated as it relates to this is our grid, this is how we staff, this is what we need. Currently, we're really trying to reevaluate how we do that work and actually use a more innovative approach that's flexible and more agile. It actually uses the tools that we already have. So it uses our EHR and our census data. It also uses our workday or our workforce data to make sure that we understand who are those individuals that are actually supporting the care of our patients. And then in addition to that, our staffing software. So it pulls those three things together. So not only can we anticipate what our patients' needs might be, it also allows us to be able to see what that census based on time looks like over shifts, but also more importantly, we can stop being so reactive to Well, if our census goes up to this and it's this type of patient, we're not sure exactly if we're going to have the staff that we need based on our current staffing model or who we have available. By actually leveraging some of our real-time data from the tools that we're already using, it's helping us not only to predict shift by shift, but it also helps us predict what our staffing needs are going to be in the future as well. So when we think about how effective and efficient we can be powered by that data, it leads to the opportunity for us to be more stable, for us to be less reactive in the fact that we're not constantly calling our staff to ask if they can work extra. But more importantly, how do we take the burden off of some of our frontline managers and leaders by using data and using our tools to actually inform a more proactive approach to the work that we do. Now, I couldn't have talked about this or been here to describe this without sharing with you the absolutely incredible team that I have behind the scenes that actually helped us accomplish this. We've got several data scientists, as well as our enterprise data and analytics team, and even more importantly, our staffing coordinators and those clinical teams that help us really identify what's going to be most valuable. How are you spending your time? And more popularly, I always use the word growth. How do we get rid of stupid stuff? What are those stupid things that don't add value to your day? And I have to tell you, some of the time that they've spent managing their schedules, adjusting the way that we manage this to make sure we have the care needs, it allows our teams to get back to work that's more valuable, as well as contribute to the ability to be more flexible for our frontline teams.
Right, fantastic. I have a couple follow-up questions on this, Erica. First is how did you get this implemented? I don't mean the teams. Like, how did you drive alignment or drive the decision making around moving in this direction to move in this direction?
Fantastic question. I took a deep breath because it's a lot of work. It's been a long journey. It hasn't been something that's happened over time. A lot of boots on the ground, a lot of one-on-one meetings with our teams to really show and display how valuable the data that we already have is to the story that we want to tell. So again, it goes back to how do we get our frontline teams engaged and involved? How do we get our nursing leaders involved? And how do we show the value then to our chief operating officers, to our chief financial officers, to really help us get more proactive about the work that we've done? A couple other things that it's really important for me to call out as it relates to this. The lessons that we learned during COVID have been incredibly vital. We figured out that we don't have to be scared about not knowing all the different pieces and parts, but how do we fail forward fast? You see those words, agile and flexible. I had a whole bunch of teams that were helping us really use the data to help us understand what the next steps of the process would be so that we can anticipate what it means. We had to take some risks. We had to have a lot of opportunities to test and pilot this with some of our larger organizations to help us understand what works and what doesn't work. And I think the other ideal state to this is, how do we keep on coming back? How do we keep reiterating what it is that we're doing to make it more refined and more easy to use, as well as then show the gains, not only financially, but in satisfaction to the teams that are using the tool.
Okay. And you might be going here next, but like, we're curious just about the impact. Like, what was the results of some of this work?
Absolutely. I'd say the thing that the teams are probably most proud of is it actually brought us to a level of standardization across our enterprise that we hadn't had before. So although we all want to say that we're a little bit different, we now know that in the NICU, with this level of care that this baby needs based on level 3 to level 1, we know that this is a typical staffing model and what that might look like. And so we can match up the schedule based on census prediction, as well as those needs of our staff, as well as the babies that we're taking care of. Same thing holds true for OB-GYN, as well as ICU and PICU. So we've been able to standardize, what does that look like? How do we make sure that we actually adjust that based on some of the nuances specific to your organization? I'd say the other thing that I'd say is really important is the fact that we were able to save our frontline managers about 40 hours a week 40 hours, like a month, in balancing schedules, in balancing so many of those other things that maybe weren't as value add work. So if we look at that picture of, we've been able to minimize some of the reactive calling. The third thing that I might just have to suggest is variable staffing plans are really an important strategy to help us as well. By doing this process, although all I'm talking about here is about data and analytics doesn't happen without effectively using our technology, as well as bringing our people bringing our people along. So people, process, and technology. You have to have all three pieces. And in addition to that, breaking some of the traditional ways of thinking was probably some of the harder things. But again, it was weekly phone calls, in some cases daily, asking those questions and being as upfront and transparent as possible to make sure that we were meeting the needs of the team.
Got it. Okay. You're discussing topics like scheduling and staffing. On the topic of, nurses asking and requiring, insisting on more flexible schedules, it's pretty clear that the days of full-time only, 3 days a week, 12-hour shifts being the only option are essentially over. Sort of how are you thinking about that topic philosophically in terms of and strategically? How are you going to enable flexible scheduling at Stanford?
Yeah, so our flexible scheduling, what's been some of the initiatives that we've used is obviously all of the nurses have a heart for caring, but there's a fatigue factor that goes along with it. And so in some cases, it came down to having lots of conversations with our frontline teams about what does flexibility actually mean to you. And in some cases, it was 6-hour shifts or 4-hour shifts. And then in all actuality, if we give that power back to our teams, it's amazing what they can figure out. So if I were to talk about some of the ways that we're doing this, is it's really continuing to get feedback from our frontline teams about what does flexibility actually mean to them, and then trying it. I think in some cases, we're always so frightened that we're not going to actually get it exactly right. But that innovative spirit, that ability for us to discover and try something has been a really fun journey for all of us to be on, even though I'll be honest, I think when we look at some of those shifts where we're so short, if we can convince our teams that, okay, if I can have you just for this amount of time, or gosh, we know this is what typically we're going to see, how do we proactively readjust the schedule and actually cover for those 4 hours? So again, I think putting some of the power back into our nurses' hands has been really important for us to make sure that they're part of the solution, but also helping us understand how do they actually define flexibility.
Okay. All right. So what's LAMP?
Oh, yeah. Interesting, right? So this is what we've coined. The phrase is, we call it LAMP. Obviously it stands for leveraging analytics to mobilize and prepare. So the way our predictive analytics model works is it's not just about reacting in the moment, but it's also planning and preparing for the next month. But then it also helps us look ahead so that we can budget for 1 to 5 years ahead. So based on our turnover rates, based on our typical influx of new hires coming in, based on other ways that we need, it actually helps us budget in the long run as well. If anyone were to ask, who do I most look up to, it would be Florence Nightingale. So in all actuality, this is a nod to Florence, the lady of the lamp, who really was one of the first nurse scientists out there that really helped us to identify, how do we use data? How do we use evidence to really learn and then advance really the science of not only nursing, but really healthcare, and what does patient care, what could it look like? So in all actuality, the idea is really about being patient-centered. How do we understand what our patients need and what that specificity might look like in the ICU, in the PICU, in the children's world? How do we be proactive? And then how do we innovate in an effort to make sure that we're doing the right thing for our patients, but also more importantly, really valuing the incredible work that our frontline teams do every day.
Great. I love that you branded it. It's probably helps with communication too.
Mm-hmm.
Right. So you had some specific goals around this project of implementing predictive analytics?
Absolutely. So enhancing employee satisfaction is probably first and foremost. What we heard from our first hospital that went live with using LAMP and the predictive analytics is we're tired of being called day after day to come in and work an extra shift. I think all of us know the heart of nurses as they want to help and they want to be part of it, but they also don't want to feel guilty that they need to take a break. So by enhancing the employee satisfaction, we have seen some increase. I can tell you that for many of us, I'm sure you can all agree that we're not out of the woods yet. We still have open gaps for the number of staff that we need. And so we're continuing to work on some of our employee satisfaction. Specifically with our staffing and scheduling, we have seen some increases in their satisfaction in their work as they've been able to enhance and look at the tool, as well as help us understand how best to make it work. I think I already highlighted the importance of efficiency. We've been able to save time. As I mentioned, getting rid of stupid stuff is the key, like gross language that I use all the time. Like, what doesn't add value? What can we do to get rid of that? We talk about it as it relates to our nursing, documentation reduction, but again, even from staffing and scheduling, how do we bring back the value add work and get rid of some of those inefficiencies in our older processes? Our improving workforce stability is another one of those goals. And as I've mentioned, when we look at what the predictive analytic tool can do, it helps us actually understand what we need today, what we need on the next schedule, but more importantly, how do we work together to plan our recruitment, retention events, and some of those things based on not just 1 year prediction, but also 2 to 5 year predictions as well. So really important goals that we're continuing to improve on, continuing to measure some of the successes in, but really proud of the team that we've been able to use some of the tools that we currently have, because I think as many of us know, dollars are quite slim these days. And so how do we use the tools that we already have and then just put a little bit more time and effort into how do we use it to predict what those needs might be?
Okay. And so these are some of the benefits, both for patients and for nurses.
Yes. So I think that I've highlighted a couple of these already, but really it is about empowering our nurses to focus on fulfilling work. I think outside of predictive analytics, we have several different technologies that we work to put in place as well to really transform how we think about care and how that delivery could happen as well. So certainly seeing some of the benefits of this project, but I think as you can imagine, it's never just one intervention that we're putting in place, it's multiple at the same time.
Absolutely. And then, yeah, what does the future hold?
Oh, perfect. So the future of LAMP is really how do we partner and actually integrate our predictive analytics tool. That's our internal data. It's all the different things that we've put into place over time to help us standardize and integrate in a different way. You can see that it's been through a collaboration with one of our teammates called FlexWise that we've been able to really put it into a visualization tool. So not only can you look at it at a local level, but for people like me that are very interested in where are the gaps, what is it that we need, how do we look at staffing and scheduling a little bit differently, I can look at it from the enterprise level as well. So it helps us to predict, align, and then plan ahead for what it might look like. So it basically takes all those interfaces, it takes all the predictive analytics that we currently have, or we had sitting on the side, and it integrates it into a visualization tool so we can see it as a whole, locally as well as at an enterprise level. So you can see how continuing to centralize some of those workforce efforts can continue to gain some of that momentum.
Okay, fantastic. There are a couple questions that have already come in from the audience about this topic. So question from Michelle, what data platform are you using for real-time staffing? Sounds like you built your own, but I just want to
so API is our staffing software, if that makes sense. So API is the staffing software, but we basically built our own, right? Yeah. So it takes the data from our HR system, our people management software, from Epic, our EMR, and our API. It takes those 3 data sources and plugs it in so that we can anticipate and plan.
Great. A question from Larissa is, can you describe a little bit more what you're using from the EHR that's giving you acuity data for your staffing?
Good question. We've just started to explore what the acuity staffing will look like. We actually based the current staffing model based on the unit dynamic. So what's the type of patients that they have? That's when it's been really important to engage with our frontline teams. So we use Epic, as I mentioned, and we're not using some of the acuity adjustable staffing yet. Because of the fact that we felt like this, based on the unit, was a more accurate reflection. And although I'm not as patient as I should be, this was a good first next step to manage the change before we went to acuity adjustable staffing. But that's the next step in our journey, is how do we use acuity adjustable? We've got some exercises as well as work to do in order to make our documentation support some of that acuity adjustable work in Epic itself.
We talked about flexible scheduling earlier, and we're working with more and more hospitals and health systems are offering a menu of options to schedules, you know, part-time, full-time options, part-time options, 8-hour shifts, 4-hour shifts, like whatever works. You know, obviously it's more operationally complex to manage, but it's what the talent wants. Question from Michelle was, you know, how do things like 4-hour shifts create consistency and not increase handoffs between shifts that could potentially increase errors?
So it's interesting that you asked that question. That was the big concern that came from our operators and even our frontline teams, that we're on our high reliability journey. We've been on that journey for 4 years, entering in our 5th year at this point in time. And so when you think about the importance of handoff and you think about the complexity that comes with 4-hour shifts, the majority of our hospitals are actually using those 4-hour shifts to help support either constant observer needs for those suicidal patients, or actually as crisis. So in some cases, they're strategically placed during a initial part of a shift, or when we anticipate more of that busy time to happen, so that we can be an extra set of hands, extra set of feet in those spaces. So the majority of the time, although they can take a full patient load, the majority of the time when it is those 4-hour shifts, we've actually created some crisis roles to help support the patient need.
Great. Next, love to talk a little bit on the topic of nurse retention, because I know that's top of mind for many people on the call. Would you mind sharing just a little bit of information just about your own nurse retention turnover at Sanford and some of the top challenges?
Most certainly. So I think, like many of us, our turnover certainly was at a height during COVID. We're seeing that turnover rate continue to come down. Currently, if I think about really our annualized turnover, the most recent data that I looked at last week was around 22%. And again, that's annualized. And I look at both ambulatory and inpatient data. Additionally, prior to COVID, so 3 years ago, and again, I think our nursing population has changed a lot over the last couple of years. Our typical turnover prior to COVID was about 11 to 12% prior to that. So we have seen an increase typical to what many had. When I think about retention and some of the strategies that we have in place is first and foremost, how do we get engaged with our frontline teams? How do we offer up opportunities for them to use their voice? So we have a shared governance structure in which not only do we have unit-based councils, but we also have that Senate structure. Because of our integrated system, we actually have an enterprise Senate as well. So we try to actually establish a very similar structure for nursing like we do for our physician governance, so that they're the voice, they help us make some of those decisions, and we make sure to engage them in really their feedback and insights. Now, as I mentioned, we're almost 9,000 nurses in our organization, and we come from a lot of different backgrounds. So being intentional about some of those decisions and access to those teams are really important. I think our VPs of nursing in each one of the markets play an important role in that as well. So first, one of the retention strategies that we put in place is our Senate governance structure. Second, I'm really excited, and maybe this team knows that's on, but Sanford Health actually has a presence across the world. We have clinics in Ghana, Costa Rica, as well as Ireland and New Zealand, as well as a couple other locations. One of the differentiators that Sanford has is we actually offer a mentorship program in which, as nurses, they can actually offer assistance and insights to our World Clinic teams, be it education, be it workflow analysis, be it vaccine support, some of those kinds of things. So it's anywhere from a 9 to 12-month experience that they have the opportunity to apply for. And part of that experience, not only is it about the project that they get to work and collaborate with the teammate with, they get to spend a week in the World Clinic partnering with those teams and actually introducing themselves to a different set of realities, so to speak. The third long-term strategy that we put in place outside of all the incredible work that we do with our colleges of nursing in our surrounding areas is our internationally trained nursing program. Our internationally trained nurses program has been a very valuable opportunity for us to not only understand the incredible diversity that we have across the world, but also to understand the best way for us to prepare, educate, and onboard our teams. I'd say, although the long-term strategy, it's been a long time coming, 18 to 24 months from the time that that individual interviews with us, it's definitely had to be that long-term strategy that we embed. We've invested a lot of time and energy in preparing our preceptors, as well as engaging with our providers to help us understand what does building a community look like in a different way than it did before. So I'd say our internationally trained nursing program has been an incredibly enlightening experience that they've taught us a heck of a lot more than we've taught them. So it's been an incredible experience that way. So I'd bubble it up to 3. I could go on and on about all the other retention strategies, but I think for the purposes of our conversation today, those are 3 that bubble to the top of the list for me.
Okay, let's talk a little bit more about the international nursing program, because that is a strategy and tactic that many hospitals are exploring. Question came in from Thea, like how many of the nurses are internationally trained, and how many have stayed actually to be permanent staff?
Oh, good question. So we actually started the journey. We were just meeting with the team yesterday. It was May of 2020 that we did our first interview. So if you recall, I said 18 to 24 months is how long it takes. Currently, we've got 280 internationally trained nurses that have joined our Sanford team. The process that we follow to date is that they're a Sanford employee and they're with us with a contract and a sponsorship for 3 years. And so what's been exciting is that many, and when I say many, 75% of the internationally trained nurses have brought their families with us. And so what's been fun is to not only embrace them as another nurse as part of our Sanford community and family, but also to welcome their family into the fold and understand what those needs might be for the teams. What's been most ideal in those scenarios is really the onboarding experience. Our internationally trained nurses actually join us in the US for 2 weeks. And in those 2 weeks, we have teams that actually walk beside those individuals to help them acclimate to the environment, especially in the wintertime, because remember, I'm in the Midwest. In some cases, they haven't experienced the bitter coldness. More importantly, though, to help get them set up for success, those 2 weeks for housing, transportation, what is that community? How do we connect them with others that make the most sense for them and what their preferences are? Additionally, then they have an additional week of orientation, some of that hands-on training before they would join new employee orientation. It's been absolutely just a joy to get to know each of them. We just had our nursing week events last month, and some of our internationally trained nurses from the Philippines actually presented at the Nursing Awards event and just shared their thankfulness and gratefulness for the work and the opportunity to be part of our culture. So we've learned a lot throughout that process and continue to learn more. I'd say some of the challenges that we have specifically in our post-acute as well as our rural communities is how do we best serve them and support them when they're in those spaces as well.
Got it. Is there, as far as, would love to touch on career advancement programs for nurses, because that is the number one thing they're looking for, and it's a key driver of retention. How do you think strategically about just providing and investing in career advancement for nurses?
Amazing question. We actually have a lot of different programs that we have in place. I love to see some of your recent statistics about the fact that 50%, I think maybe it was 51%, are actually wanting to advance their careers. As mentioned, we've got several different colleges around the area that help us actually advance that. We're actually the clinical site for several advancements in APRNs as well as other careers. I mentioned about the World Clinic Mentorship Program as one of my favorite programs, just because of the incredible experience that we gain. I'd say the other advancement opportunities that we have is that we have several leadership courses, not only hybrid versions, so that online and virtual, or excuse me, online and in person, but we have a lot of leadership academies that we've set forth as well. So no matter if it's advancing their career through college courses or through how do we create a career pathway for our nurses, we have opportunities and options for them no matter what their choice might be. Again, it's a phenomenal partnership with our HR teams to make sure that we create some of those pathways and opportunities for learning. So again, it goes from micro learning, if that's what they choose, to how do they get involved in unit-based councils, to scholarship programs as we help them get to advancing their degrees, even from a patient access role potentially to nursing, or even a patient access to a med aid. So we've got a host of different pathways that we've set up for our teams to build really whatever it is that makes the most sense for that employee.
Okay, fantastic. I'm going to next share just a little bit more about Incredible Health, and then we'll come back and do Q&A. There's actually a lot of questions that have been submitted about your retention strategies and your hiring strategies. So very briefly, just wanted to share that Incredible Health is a software company. We're based in San Francisco. We operate nationally, and hospitals and health systems, they use our technology to hire nurses in permanent roles in less than 20 days. And we work with over 700 hospitals and health systems, including very large ones like HCA and Tenet. We work with many regional systems like Wellstar, Baylor Scott and White, and many academic medical centers as well, like Johns Hopkins and Stanford and Cedars-Sinai. There's probably a few unique things about our platform. First, the employers apply to the talent instead of the other way around. As you can imagine, the nurses love that because they create a profile, they sit back and relax, they get interviews from different employers, and the nurse gets to choose which interviews to accept or decline. So this is a very nurse-centric or candidate-centric platform. The second is that there's some level of pre-screening that's happened before they've been put in front of the employers. And then also we do match based on both the hospital's needs as well as what the nurse is requesting or requiring. As a two-sided marketplace that's powered by software, we have access to an enormous amount of data analytics. So nursing leaders and HR leaders use our reporting to compare themselves to their local competition and their national competition, to identify bottlenecks, to see which hiring operations they need to change or modify. And then we also offer lots of best practices for nurse hiring too. On the nurse side, it's very important to us so that we offer a whole range of free services and tools to them. This is not just the place where a nurse finds a permanent job. Incredible Health is also the place where we can help them manage their careers. We offer free continuing education to every single nurse in the country, accredited in all 50 states. When nurses sign up on our platform, they get access to career coaches, or what we call talent advocates, to help them navigate different opportunities. There's also free salary estimators. There's a community for nurses built into our apps where nurses can get advice from each other. And everything on the Incredible Health platform is 100% free for nurses. I just want to kind of highlight some data from our platform. Probably one of the #1 findings that we see in our data in every single local market where we operate is that speed matters. Speed in hiring matters a lot. It's actually the most important factor. It's even more important than compensation. It's even more important than than the employer brand. 68% of nurses accept the very first offer they receive. And again, I'm talking about permanent hiring, not temporary. And 61% of nurses accept the very first offer, even if the second or third has higher compensation. And so we're seeing that speed in hiring operations is really becoming a competitive advantage for hospitals and health systems. There are many tactics that hospitals have put in place to enable speed, things like directly scheduling with hiring managers, reducing the number of hiring managers, enabling same-day job offers. There's, adopting a philosophy of no nurse left behind. So if you're speaking to an experienced nurse, find a place somewhere in the health system. So these are all tactics and practices that we're able to share with the employers we work with. This is a quick case study. This is a team in LA where we were able to reduce the days to fill from 66 days down to 19 days. Where we had the biggest impact was on time to source. And then we also shaved off days in later steps of the process with things like automating interview scheduling too. And then we were often asked about retention. So when nurses are hired through the Incredible Health platform, our studies show that the retention is about 15% higher than the hospital's baseline. The reason for that is twofold. One, the nurses were able to consider multiple opportunities before selecting a specific health system. So it's a very well thought out job search process. And the second reason is our bread and butter is with experienced nurses. Yes, 50% of the employers also use us for new graduate nurses too, but experienced nurses tend to have better retention than your new graduate nurses. And then finally, it's just the way we work together. So this is a true partnership. When we are partnering with a hospital and health system, we are partnering across the hiring process. So everyone has roughly the same 8 steps. Incredible Health is doing a lot of the heavy lifting in the first 4 steps, automating ensuring we're sourcing the talent, pre-screening them, confirming they're actively looking and getting that first phone screen scheduled automatically. And then at that point, the in-house talent acquisition team, in this case, the Cedars-Sinai team, takes over. They're completing the phone screens, getting hiring manager reviews completed, getting offers out and getting them accepted. So essentially the nurses are entering the quote unquote normal hiring process after that. This is a newer model in talent acquisition. I know Erica has talked about ensuring that nurses are operating at the top of their license and the top of their skill set, but we also need our recruiters and our talent acquisition teams to operate at the top of their skill set, which is engaging with candidates, building relationships with hiring managers. Some of the more administrative work, like sourcing and pre-screening, can be handled with software like Incredible Health. All right, there are quite a few questions that have been submitted. So one question for you, Erica, is beyond, you mentioned the international nursing program. Are there any other tactics or strategies that you're putting in place to increase the amount of hiring of permanent nurses at Sanford?
Really great question. So I think in some ways, I really appreciated your feedback around talent acquisition. I think that speed is really incredibly important. And so we partner with our HR team and the talent acquisition team. Some ways that we're having that speed to execution is we have group interviews. So for those teams, those group interviews have been really helpful so that we can also then give, we can make that request and we can actually offer on the spot instead of waiting for some of that administrative burden to happen. That's one piece. I think the other thing that I'd want to call out outside of international nurses, as we are trying to work through what it looks like to use technology to support those non-value add work. When I talk about that, that means how do we help our nurses actually give up some of the things that we think we have to do? And how do we force and have some of those roles in place so that we can have that team-based model in our inpatient setting so that we know we've got a team, we've got a reliable team, and that as a nurse, you need to make sure that you're focusing on some of those efforts. Additionally, we're investing in a virtual care, or we're going to call it remote nursing, not virtual nursing, but we have a remote nursing pilot that will be up and running soon to really help us reduce some of that documentation burden, as well as just bring some of the joy back to the work. So it's been really fun to actually challenge some of our assumptions as it relates to workflows, and really understand how could we actually use a nurse that sits in a hub to help us do some of that work. I know for many of you, you've probably put in place a telesitter program. This really takes this to the next level and really uses that wisdom and experience of some of our nurses to help support. what we've learned is that in some cases, that flexibility of a shift might be enhanced by having that virtual shift, be that 4 hours or 6 hours that you can come in and help out in some of those ways. So we're trying to get creative in a multitude of different ways, not only getting rid of those things that maybe don't add value to their work, but also how do we apply technology that our nurses find valuable? But then third, how do we make sure that we have the right teammates around our nurses to be sure that they're doing the work that's most valuable for them? And again, as we onboard lots of new staff, as we have a lot of students within our walls, how do we invest in them and some of the education preceptor courses, as well as leadership courses to help support them that way as well.
All right, fantastic. We're getting a few questions about the recording. The webinar is recorded and a member of our team will definitely be in touch with the recording. And we're going to go continue to the top of the hour with Q&A. So if you have more questions, please feel free to submit them. And then if we run out of time, you're welcome to send questions to questions@incrediblehealth.com as well. The next question I have that came in for you, Erica, is just around nursing schools. You mentioned briefly around partnering with your local nursing schools. Can you highlight a little bit more about what do those partnerships look like and what are both parties giving to each other?
Oh, what a great question. And it's also a loaded question. As you can imagine, we've got relationships with about 600 nursing schools around our area. And the reason why so many is not only do we partner with them for nursing, we partner with them for other allied associated things as well. If I were to highlight and summarize in 2 bullet points, for some of our colleges, it's about getting creative around how do we enhance more of a competency-based model, knowing that that's some of the work that's going to be coming in the future anyway. How do we get flexible, not just around our inpatient nursing, but how do we get flexible about what it looks like to bring people into nursing schools and help them, knowing the complexity of people's lives, be it single parenthood or taking care of other loved ones. How do we allow them more flexibility to help support that work? So working with our colleges of nursing to help manage that. I'd say that the second way that we're supporting or looking at things is we're helping to fund additional accelerated programs. So again, a lot of pilots, a lot of ability for us to look at accelerated programs. If I think about some of the advancement opportunities that we're looking into for our APPs, is how do we bring coursework together? How do we bring simulation to our rural communities so that they continue to have that ability to practice some of those skills, knowing that they're low frequency, high risk. So we use simulation and technology to help us with some of those pieces well. For our other teammates, specifically as it relates to our colleges of nursing, we actually partner with them to do additional preceptor courses, as well as other conferences, evidence-based practice, as well as research projects. Social determinants of health, as I already highlighted from some of those rural challenges. What I found has been most intriguing is all of us want to try to address some of the challenges, not only of our workforce, but the complexity of the patients that we have the opportunity to care for. So I'd say that's some of the other strategic positioning that we've been doing. I mentioned about our world clinics. It's been fun to actually work on what could an exchange program look like so that we can partner with them, not only to use their simulation centers, but to use their talent with education to onboard our internationally trained nurses in a more effective way. So lots of different ways that we partner with our colleges, not only for nursing, but also for allied health fields and things like that as well.
So one of the top challenges that nursing schools have is not enough faculty, right? Mm-hmm. Do you allow your nursing leaders or your experienced nurses to precept or to teach at nursing schools too?
We do. It's so fun. Actually, part of my work on a monthly basis is to round, and some of the places that I round is in our colleges. And what's really fun is when I go to those colleges of nursing, the majority of the clinical instructors are our employees. And so it only helps actually give us that that collaboration to understand these are some of the things that are changing. Gosh, how do we adjust some of the curriculum to make sure that we're adjusting at the same time? So yes, we welcome the opportunity to have clinical instructors. It only helps us when we think about the clinical experiences that our staff have. I think one other example that I probably haven't highlighted, and I'm sure many of you have this as well, is internships programs. Our colleges have been essential to help us understand who are those high performers. How do we make sure to advertise the important program that an internship can have? And then also the extended internship. I think what that benefits us with is we've basically trained this incredibly talented, motivated new nurse before they've hardly even graduated from college. And so those internship programs have been a great collaborative project for us that doesn't only help the College of Nursing, but also helps our healthcare systems on the backside.
Great. The question that came in from Patricia is around float pools. So back to the earlier discussion around predictive analytics.
Yeah.
Are you using float pools or nurses floating to different units and sites? Was that, an output of the work, or how do you think about that?
Fantastic question. Thanks, Patricia. So we have a couple different philosophies in mind. We actually have an internal float pool. So when I say an internal float pool, they have 13 to 18 week assignments that they actually do float around to all our different medical centers. Obviously, they have orientation. We do accept new grads into that program, which means that they have a little bit longer orientation. So we do have an internal float pool. One of the strategies that we put in place when COVID happened that we've continued is all of our contract labor teams on the inpatient side actually go to the float pool. That's the expectation when they start with us, is that they're in that float pool and then they can be dispersed to those specific locations as needed. The third is that we've developed our own internal agency as well. So we've got a couple different strategies in place that I'd like to just highlight as it relates to your question around floats.
Okay. Are all those working? Are they having impact? Or are there some that are less effective than others?
Really good question. I think you highlighted this earlier that we are dealing with a different generation of nurses. And so their flexibility and willingness to be in some of that float type dynamic isn't maybe as readily as it was before. I can tell you, being part of the Sanford team for 28 years, I was afloat and it was my favorite job because I got to see a ton of people. I got to take care of a lot of different kinds of patients. I think in many cases, the float or even that internal agency offers some flexibility, but maybe not all the flexibility that some of those teams would want. So we have goals of 75 in our internal float pool. Right now, I think we have 32. So those numbers are shrinking because people are shifting around. One of the other strategies as it relates to that internal float pool, as well as the internal agency, is how do we retain some of those teams that maybe if they don't want to be in that specific unit, what are those other options that we can offer to them? So I'd say with our internal float team, 70 to 80% of those individuals stay within our system, but just get assigned to a specific unit. So if that was my measure of success, I'd say yes, but there's never quite enough. I think all of us would agree with that too.
Absolutely. Okay, in our last minute, I'd love to ask, what are some of your top tips, top 3, top 1, whatever you like,
all right,
for the leaders on the call who are tackling nurse hiring and nurse retention challenges?
I'm not sure that it's anything that I haven't mentioned, so I'll name 3. 1, make sure that you involve your frontline teams. They almost always know the answer to the problem. And so ask them. They'll probably tell you, sometimes in a positive, productive way, maybe not always productive, but ask them, they'll tell you. Second to that, how do we start embedding technology into the work that they're doing every day to get rid of the stuff that maybe isn't as value add? So that would be my second. And then third, how are we as leaders in our organizations going to continue to grow and challenge some of the traditions that we have in healthcare that's gotten us to the place that we're at today?
That's fantastic. Those are great tips. Thank you so much for your time today, Erica. We really, really appreciate it. You've shared a lot of insights, a lot of strategies, a lot of tactics that are very practical in nature, which we appreciate. And just, yeah, thank you again for your time.
Absolutely. My pleasure. Take care.
All right. Take care. Thanks everybody for joining.